Good day, I'm Elisa Marie Di Valerio and I'm a student nurse from CAC. And in this video, I will demonstrate how to do blood glucose test to a patient. Blood glucose test measures the glucose levels in your blood. Glucose is a type of sugar that it is your body's main source of energy. A hormone called insulin helps move glucose from your bloodstream into your cells. Too much or too little glucose in the blood can be a sign of serious medical condition. High blood glucose levels like hyperglycemia may be a sign of diabetes, a disorder that can be cause heart disease, blindness, kidney failure, and other complications. Low blood glucose levels like hypoglycemia can also lead to major health problems including the brain damage if not treated. Now this is equipment needed: the meter, the strip, the lancing device, and the lens. And now introduce yourself to the patient. Good morning po, I'm Elisa Marie Di Valerio and I'm a student nurse from CAC. Then verify the patient's identity. Ma'am, can I ask your full name po?
Yes, nasa sa Trinidad, born on November 28, 1950.
Okay, thank you.
Perform hand hygiene to reduce bacteria to the hand. But first, let me remove my watch before performing the hand hygiene. We do hand hygiene because it is a key of washing our hands to make sure that we thoroughly clean all surfaces and areas of our hands, fingers, and wrist. And now I'll perform the 7 steps of hand hygiene according to who. First, wet your hands with clean, preferably running water. Then, apply soap to cover all surfaces of your hands and wrist. Then, lather and rub your hands together briskly and thoroughly. Rub your hands palm to palm in a circular motion. Then, clean the back of each hand with the palm of your opposite hand. Then, scrub between your fingers, interlocking your fingers and rubbing back and forth. Then, clean the back of your fingers by rubbing your interlocked fingers into your palm. Then repeat for both hands. Then clean around each thumb with the opposite hand. Rub your fingertips into the palm of your opposite hand and repeat for both hands. Then rub your fingers into your palm for both hands. Then wash each wrist with your opposite hand after. Then rinse thoroughly with preferably running water. Then after completed this hand washing or hand hygiene technique according to who, dry your hands using a towel. Use a towel to lock the faucet. Then discard the towel properly.
So ensure the patient's privacy and dignity. Check the room also for contact precautions. The next, explain the procedure and purpose of the procedure to the patient. Good morning po. So now I will do the blood glucose test. It is to identify blood sugar levels that are high or low. If you have diabetes, it will help you monitor the effect of the diabetes medication in blood sugar levels. Now I'll look at your hands and find a good place for test. Then to perform blood glucose test, I'll begin by assessing the patient. To know a particular condition of skin, possible puncture sites such as the fingers, look for edema, inflammation, avoid bruises, areas, and open lesions. The patient should be sitting comfortably in a chair or in semi-collar's position in bed. But before I proceed, I'd like you to wash your hands first. Now, insert the lancet or needle in the chamber of the lancing device and remove the positive cover to expose the needle. Then now, check the expiry date of the strips. Insert the unused strip into the meter until the meter beeps or the screen turns on. place the loaded lancing device against the edge of the fingertip and push the button until the needle is released. Now wait for 3 seconds to squeeze down the finger until a drop of blood comes to the surface. Then slow flow the end of the strip into the drop of the blood until the meter either beeps or show the countdown on the screen. Then wait for the result and make it down in your logbook. And now, remove the cap from the lancing device and pull out the lancet or needle, then discard the lancet in a sharps container. Discard the lancet in a sharps container. And now for the results. So I already took the blood sugar level of my patient before meals, and she gets 79 mg per deciliter, which is totally normal. Now I will flash here the normal ranges of blood glucose levels.